Next, I want to show this graphic, gentlemen, on how breast implant works. Let's look at this, and Dr. Calva, maybe you can walk me through this.
Yeah, so this is, if you see on my left, the before surgery, that's the normal breast gland. You can see the little duct, and that's the normal parenchyma. If you see the red lines right to the right of the yellow dots, that's the muscle. And the typical plane, which is, there's two planes where the implants can be placed, and you can see them on the left and on the right. The subglandular means that implant, silicone or saline, they get put right underneath the gland, and that gives you more projection. It pushes the gland up more. It looks more rounded. If you go into the subpectoral, which is the next one, the implant is underneath the muscle, so it protects the implant a little bit more from capsular contracture. It looks a little bit more natural because you have a little bit more tissue, but that's the two planes where they put them in. There's another plane called the dual plane, or there's two planes where part of the implant sits underneath the gland and part of the implant sits underneath the muscle. And that's what most plastic surgeons typically use, although all of these are used.
Okay, so that looks fine, that looks normal. Now,
correct.
We're going to show you a slide of a breast implant rupture, and this is amazing to see. Dr. Corey, you take it away now.
Well, patients come to us with the implant rupture when they have problems, they have contractures, and
let's take this slide if we can. There we go.
This is how a mammogram would look when there's free silicone inside the breast. It's really dreadful. And these are two implants that are really ruptured. This is the scar that the body has formed around the implant, and if you cut that scar like we've done here, you see just free silicone, just liquid silicone, and all falling apart. And this graphic picture shows what you could look like if you lose a lot of weight and those implants contract. I mean, it's pretty dreadful. Obviously, this is an extreme, but we get women not too far from that.
Wow.